I'm Emily. I'm currently the virtual groups coordinator for Battle Scars. Give me a second. So for those of you who might not have heard of us, we're a small charity, but we're growing fast. We support people who self-harm, of course, but we also support the people in their lives around them, so that they can support the people that they care about better. We train professionals too, and our goal is that the better understanding that they have around self-harm, then the better they can support their patients who use it as a coping strategy. I wanted to kind of start by sharing our definition of self-harm with you, because it's quite different to a lot of definitions that I've come across in the past. So at Battle Scars, we define self-harm as like self-harm inflicted on the body with immediate and longer term effects, such as cutting, burning, scratching, pulling hair, inserting objects, overdosing, eating disorders, but not including drug or alcohol abuse unless it is combined with one of those. But on top of the physical self-harm, we also talk about psychological harm to the self. So that could be things like self-neglect, obsessive negative thinking, sabotaging relationships, maintaining like a similar pattern of damaging relationships, that sort of thing. I think the most important and unique thing about Battle Scars is that the support we offer is peer support across the board. So everyone who is involved with Battle Scars, from volunteers to staff to trustees, has lived experience of self-harm. Most of us, myself included, use self-harm ourselves. Some of our volunteers are parents or partners of people who self-harm. They can bring kind of a bit of a different perspective. We've found that this means that our service users can relate to all of our volunteers, which in turn kind of leads to them being more open and the groups feeling more accessible to them. We don't have a goal at Battle Scars to stop people self-harming, unless that's their goal. Our aim is to provide a service where people feel supported and understood, somewhere they can come where there is no judgment, where it's safe to talk about whatever they need to talk about. We started off originally as face-to-face groups, then along came COVID and lockdown. So we've built our virtual services like up as a response to the demand, and there was a lot of demand. We've had to add many groups along the way from the 2, I think we started off with. So at the moment we're hosting around 10 groups a fortnight. And we have a variety of groups, from like standard groups to groups for people who are self-harming less or not at all, but still struggle with intrusive thoughts or urges. And we have groups where people can just come and talk about what's bothering them, groups of topics, and we have social groups which are actually really nice as well. We have them sort of twice a month. Most of our groups have kind of a topic that is developed by the facilitators. So we might look at things around pros and cons of self-harm, or something around boundaries and trust. We kind of have the topic so that there is something to talk about in the groups, but if the service users are coming along with something they specifically want to talk about, as long as the content is safe and not something that's going to trigger others, then we kind of allow them to steer the group a little bit. Really easy process to attend our virtual groups. So there's just a self-referral form on the website, and people can give us any name they like, Mickey Mouse, Joe Blogs, whatever. We just need an email address to send the invites to. So once we've added them to the invites list, then they'll get emails inviting them to all the groups that they've expressed an interest in. The only other thing we ask for is the first part of their postcode and how they heard about us, just for statistical purposes. I mentioned that as well as having groups for other people who self-harm, we've also got a parents and family group which runs fortnightly. That's about an hour and a half long, and the discussion there is very much led by service users. We don't find that they ever have trouble thinking of things to say. It's quite it's a tough group. There's a lot of emotions running very high because a lot of them are parents of sort of teenage children. So yeah, they can be quite emotional groups. On top of our virtual groups, we've also got a Facebook group. So we've got over 3,700 members now. It's kind of really heavily moderated, and the rules are pretty strictly enforced. So things like obviously no graphic photos or descriptions, no personal criticism, and we ask people not to message each other privately, just because we want the discussions to take place within the group where admin can then offer support if somebody needs it. And we've sort of had a few messy situations in the past where people have private messaged. Excitingly, we've just restarted 2 of our face-to-face groups in Leeds, finally, after lockdown. So they take place every 4 weeks. You don't need to refer yourself to them, no referral laws needed, don't need to book. Simply just drop in groups and you can attend as many as you want of them. We're trying to work on a model of face-to-face groups that can be created anywhere. It's a way off, but our goal is to start being able to replicate that model in different parts of the UK, which is quite exciting as well. We also run a 16 to 25s weekly group, which is face-to-face. That's quite a new thing. And another new thing we have going on is a pilot project called Fresh. So that requires a professional referral from A&E or minor injuries, or a GP as a follow-up to a patient having presented at A&E or minor injuries. At the moment, we've got the 2 Leeds hospitals, 2 GP surgeries, and 1 minor injuries unit on board. Like I said, it's still in its early stages, but it's getting there. And that really involves if someone goes to A&E with a self-harm injury, the referral means that they'll get a phone call from one of our Fresh team. They have an hour to talk about whatever they want to talk about, and the volunteers will support them as far as they can, and then refer them to our services or signpost them to other services if we think they're sort of if they'll work better for them. We do have quite a lot going on at the moment. Just a couple more things I want to mention. We have the addiction program, which is a self-help workbook we've created, a free self-help workbook, looking at things such as self-awareness, exploring your own self-harm, developing coping strategies, and we've started running sort of ad hoc groups to support people who are perhaps becoming stuck in some areas of the workbook. We do have under 18 services going on. I'm quite involved in them, something I feel quite passionately about. So at the moment we're running assemblies and workshops when we're asked in schools or at youth groups. And I really enjoy working with the young people. We've found it's incredible how self-aware they are, and it's still difficult for us to get into schools though, because everybody is convinced at the moment people walk in with scars start talking about self-harm, then obviously everybody's going to start doing it. So we're trying to work out how we can get our foot in the door a little bit more. And Lastly, we've also have training for professionals around self-harm and more specifically eating disorders as well. So we offer like Q&As or full day workshops. There's a whole list of things that we offer that's on our website. If anyone is interested. And I think, I'm sorry if it's annoyed you that it's not coming in the order that it is on the slide, because I've kind of annoyed myself that I've not matched it up. But yeah, that's what we have going on at the moment.